You can get really, really poorly from this, and it's not something you can just really quickly get out of.
I used to be Queen Handstand. I used to be.
We are seeing hospitalisations in children going up dramatically.
There are currently 117,000 children in the UK with long COVID, according to the Office for National Statistics, and 20,000 of them have been unwell for over a year. And these numbers are on the rise. And yet it feels as if we've been told that COVID isn't something we need to worry about in children because the risk of serious illness is so low. It certainly wasn't on Emily's family's radar until she got COVID 5 months ago. She spent 14 nights in hospital and still has numerous symptoms, including pain so severe she has to be on a type of morphine. She can only go to school for a couple of hours a day.
The pain in my body is stopping me from moving properly, and so I'm having to rebuild all the muscles in my legs and back. It's really hard.
It's utterly devastating. Ems was a child who loved socialising. She loves being on the stage, she loves dancing, singing, acting, she loves swimming, and all of that has been ripped away. She is an academic, she loves being at school, but she can only be there for 2.5 hours a day. It's utterly heartbreaking that all of a sudden a child who had no underlying health conditions, who was completely fit, who was swimming lengths of a swimming pool 3 days before COVID, can now hardly move without being tired and in so much pain.
She's working incredibly hard to recover and is walking laps of her garden to raise money for the NHS, but also because she wants people to understand that long COVID can happen to children.
I just need to do this because not very many people are aware of the massive effect that it's giving to children and people all over the world, and it's just to raise awareness of COVID.
It goes without saying that a 9-year-old shouldn't feel she has to persuade people to take her chronic illness seriously, but she doesn't want what's happened to her to happen to anyone else.
Good job, Ems, that was brilliant. Well done.
They're still not sure exactly how many cases develop into long COVID in children, but it's thought that up to 1 in 7 will still have symptoms 3 months after their initial illness. That means if a whole class of 30 gets sick, as many as 4 might get long COVID. And we also don't yet know the impact of Omicron.
Okay, big feet up.
Statistics are important, of course, but talk to any child with long COVID and you know this is something that matters. Jasmine has had long COVID for a year and uses a wheelchair now to help her manage her severe fatigue. Even watching telly can make her exhausted. Hearing her talk about who she used to be is devastating.
I used to do gymnastics, swimming, karate and dance, and I used to be able to go to school full time and go and meet up with my friends. I can't do any of that now because it's too much.
Like Emily, she can't manage school full time and he's worried about starting high school this September.
I don't want to be really the ill kid that can't go in and hang out with all the other kids. I don't really want to be that. I want to be like how I was and to socialise and to have my full education.
There are currently 15 paediatric hubs for children with long COVID in England, but the referral process is complicated. In Wales, Ireland and Scotland, there are none. Jasmine's mum, Benita, is a respiratory consultant and knows that children with long COVID need much more help.
I really feel like the children have been hung out to dry. No, the younger kids in particular, no vaccination, no mitigation in schools, no protection, no support, and the medical services are incredibly patchy. I think the first thing we need to do is have acknowledgement from the government that this is a problem. We need investment, we need research, and we need NHS services to be supported to be able to prescribe the treatments that are working in adults.
She's right about the research. It lags far behind what's happening with adults. The charity Long COVID Kids are campaigning hard to address all of this.
To hear that the minimising that has been going on, for me, is just, it's like watching a slow car crash. It's just horrific because we know the reality of infection in children. and we want our community, the parents living with this, want to protect other parents from having to go through this with their children. We're seeing soaring numbers of children infected with COVID. And of course, we don't know what the outcome will be for those children because we don't yet really know why and who will get long COVID.
There is still much to learn. For Emily and Jasmine, it's simple though. They just want to be able to do the things they could before long COVID.
It stops me from dancing and doing my passions, like being on stage and just being me.
Sometimes you don't appreciate what you have until it's gone, and I think that's really highlights my illness.
It's a lesson that no 11-year-old should have to learn. Ruth Liptrot, 5 News.